built my own sort of way to practice surgical techniques. You know, although kind of basic surgical techniques, I'm just passing needle drivers and I'm working on needle handling and things like that. But it is the foundation of surgery, right? So it's really important that I work on these foundational skills so I can then build upon in the operating room. So the first technique I really want to show you is how to do a simple interrupted stitch, okay? And then I'm going to teach you horizontal, vertical mattresses, and maybe some advanced techniques for those who already have a good foundation. So let's get started here. The way I'm going to grab my needle, there's many ways. I guess the safest way would be to kind of lay it on a nice surface here, on a flat surface that's not going to injure anybody, and boom, locking it, right? I didn't explain this in the last video, but the way it locks, as you can see, you got to basically push your thumb in and then your index finger out. Now, if you're left-handed, it's kind of the opposite, right? Instead of pushing out with your thumb, like I'm doing here, I'm pushing my thumb this way. My ring finger is going that way to unlock it, right? If you're left-handed, you got to pull in with your thumb and push out with the ring finger. You can even palm it with the left hand. You got to use your middle finger to basically pry it open. This one is hard. It involves a lot of practice, but like anything, it's just a motor skill, and motor skills are developed through practice and sleep, of course, because things get consolidated in your sleep, particularly REM sleep. I think that's when motor skills get kind of finalized. But okay, simple interrupted stitch. I'm gonna bring this a little bit closer. I'm gonna load my needle driver either flat, so hope you can see that there. So flat, or maybe at a little bit of an angle, okay? And that's just to help you triangulate the lesion, whatever you're working with. I like just a little bit of an angle, if not flat. It really doesn't matter. You kind of want to scoop the skin with your Adsons because you don't want to be too tough with it in real life. I mean, you don't want to leave these pop marks. I did talk about how it's better to leave this than that on skin, right? Because it's going to be a large surface area and it's going to create a big indentation. But you still want to be careful with the skin, and you just want to pass through. Notice what I'm doing here. I'm using both hands as I'm doing this stitch. See if I can zoom in here. So I'm moving my non-dominant hand towards my dominant, see? And I'm passing my needle through. And you can do this in 2 bites. If you do it in 2 bites, you unlock, lock again, and then you're gonna scoop and pass it one more time, right? And that's gonna be in 2 throws. You can do it in 1. You can either bunch up the skin together and pass it through, or maybe you can do something like this, and you went through both sides of the lesion, right? This is a very common question. How far away from the wound do you go? And how deep, right? Essentially what you're trying to do is a square. You're not trying to do a rectangle here. So it has to be all proportionate to how deep you're going with the needle driver and the length, right? So if I'm going super deep in here, I'm not going to grab it from very close to the skin edge. I'm going to go a little bit deeper because I want everything to be proportional to each other. So if it's a very shallow pass here, I'm going to go closer to the skin edge and pass through, right? In this case, let me just do something like this. Okay, what I'm gonna do here, you have 2 options. If you're starting off, I would recommend leave that alone, put it on the side. Once you get more practice, start palming it. In that case, you're gonna use these 2 fingers to palm it, and now you have your index and thumb to work, okay? And what you're gonna do is you're gonna pull this all the way through, right? Till you get a very small tail. What you wanna do is basically you wanna grab anywhere from like twice the length of your tail. So maybe something like that. You want to push your tail forward to create a little bit of a loop, and that's going to help you, especially for materials that have a lot of memory. So think of fishing line. It has a lot of memory, right? And this is going to help you create the loop. So you're going to do a surgeon's knot, which is essentially 2 throws, right? Surgeon's knot is always 2. So 1 and then 2. And then I'm gonna grab the edge of my tail here, and I'm gonna cross my hands. Notice that my needle driver's on the left side, on the right side, and my hand's on the left. So what I'm gonna do is bring this needle driver over to this side, and I'm gonna pull with my hand. And I'm gonna leave my needle driver at the skin side, because if I start pulling with my needle driver, look what happens to my tail. The whole point is to conserve suture, especially when you're practicing. So I'm gonna leave my needle driver here and pull with my hand. So that's one throw. Hopefully, the whole point of this is to create enough friction here to bring the skin edges together. That's not always gonna work, right? Because if I were to try it here and I do a surgeon's knot, 1, 2, oh, you know, it's gonna keep coming apart. So hopefully whatever you're closing does not have like this much tension. This is a tricky thing to close, and it involves using slip knots, which is all you're doing is bringing one end of the suture up and then you're slipping everything down. And that allows things to slide nice and easily. But let's just do a normal throw here. So I'm all the way through. I'm gonna do two throws, remember? Surgeon's knot. I'm gonna come out this way, bring the needle driver close to the skin edge. I'm gonna go ahead and now, from now on, do one throw at a time. So 1, grab, and then opposite side. And now I'm gonna pull with both sides to make sure that that's cinched down pretty good. And now I'm gonna bring it here, and then one more. And then I'm gonna bring it up. So it doesn't really take too much when it comes to braided suture types. See, these have a little bit of, they're multi-filaments and they're just intertwined together. Compared to monofilaments or like fishing line, for example, it's just one single thing. It's gonna slide a lot easier, and that one's gonna have memory, so it wants to come apart. So in that case, you wanna do more throws. So maybe like 5 throws versus 3 throws, something like that might be the difference there. Next stage I want to talk about is called the horizontal mattress suture, okay? So the reason why you would want to do something like this is basically if the skin is under tension a little bit. And there's 2 types of sutures you can bring edges together with tension. You got the horizontal mattress and the vertical mattress. And I included some schematics of how this thing works. But essentially you're going here, right? Maybe you bring your tissues together. Maybe you can do it in 2 bites or 1 bite. Whatever the case may be, right? Here's a trick, okay? Because the next suture, I want to pass it backhand and go this way, right? Towards my right. So what I can do, let me zoom in, is use the friction here to twist it on my needle driver. And that's going to load it up backhand very nicely. And then I can go in here, right? That's one way to do it. Another way to do it is once you're here, you can twist it with your needle driver. So maybe I can bring it around this way. And now it's loaded backhand. I clamp it. And now I'm going to go this way. And I have my tail. Again, everything applies here. So you're going to push your tail forward. I create my 2 loops. I'm going to grab the very edge of that tail. I'm going to leave my needle driver close to the skin side, the incision, oops. I'm going to leave it close. I'm going to come back around and I'm going to cross. And there you go. Slides, okay. And then once you want to cut it, you just go in, twist, and you leave a tail. If you're at the skin side, if you are leaving anything exposed, you do want to leave a little bit of a tail, right? And that just helps people grab onto the tail when they want to cut it. Maybe they're going to use some mats and browns, right? Maybe without the teeth. And they're able to come in here, grab the tail, and sort of cut right there, right underneath the suture. There's some special scissors that hook underneath the suture. Have a special thing right there. Vertical mattress suture is harder to show in this schematic, so I'm going to go ahead and flip this over and show you. So here in front of us, this is called Penrose tubing, and it's used in surgeries. You can find this online. I got it on Amazon, but to practice anastomoses. But let me go ahead and make an incision here so you can see what I mean by the vertical mattress. Okay. A little bit of a curved incision, but that's okay. All right, so essentially what you're doing is far, okay? So I'm gonna start maybe out here. I'm gonna take this in 2 bites. I'm gonna reload close to the incision site, and I'm gonna pull through so it doesn't traumatize my tissues later on. You'll see what I mean. And then I can grab the skin edge, use some of this hook, some of those teeth to help me. And I want to come out basically on the same side, same distance on the other side, right? If I can grab this thing, okay. So maybe something around there. Okay, fair. What I'm gonna do now is flip it because I want to do backhand, and I'm gonna go near and come out near. So in that case, I'm gonna come out right there, and I'm gonna present the tissue to my needle, so both hands are working. And I can maybe take this in 1 bite. So I'm gonna go here again. Oh. So far, far, far to far, near, near. Okay. At this point, you close it. And you see, it really everts the skin edges. And eversion is really nice when it comes to healing and things like that. Oh. Okay, once I get my edges, I'm gonna clamp the tail, and I'm gonna bring my suture up. Let me show you. Let me zoom out a little bit. So something like that. I go ahead and grab the skin and hook it underneath with my fingers, okay? And that tells the person cutting my suture to go ahead and cut it somewhere around there. So leave a centimeter. Centimeter is about the width of a pinky, so you can probably use that as reference. And that is the vertical mattress suture. It's used for areas of high tension, areas that can possibly tear sutures. Maybe you're suturing something in the hand. Remember, the hands are high traffic, right? So high tension areas.